What is GlycA in lipid monitoring and why does it matter? Have you ever wondered what GlycA is and why it's becoming a hot topic in lipid monitoring? GlycA is a biomarker that comes from N-acetyl glycoproteins. These proteins have carbohydrate chains attached to them. When we measure GlycA in the blood, we get a glimpse of inflammation levels in the body. This is crucial because chronic inflammation is a known risk factor for cardiovascular diseases, often linked to high cholesterol levels. To break it down further, glycoproteins are proteins that have these carbohydrate chains. The process of adding these chains is called glycosylation. This differs from glycation, where sugar molecules bind to proteins or lipids without the help of enzymes. N-acetyl glycoproteins are a specific type that contains N-acetyl groups. GlycA acts as a composite marker that reflects the levels of these proteins in the bloodstream. So, why is GlycA important? First, it serves as an indicator of systemic inflammation. When GlycA levels are elevated, there is an increased risk of cardiovascular events and even mortality. This is significant because inflammation plays a big role in the development of atherosclerosis, a condition where plaque builds up in the arteries, often associated with high cholesterol. In the context of hyperlipidemia, GlycA provides additional insight into cardiovascular disease risk beyond traditional lipid profiles. It helps identify individuals who may need more aggressive management of their risk factors. By monitoring GlycA levels, healthcare providers can better understand the inflammatory aspect of cardiovascular risk. This can guide treatment decisions, such as whether to use anti-inflammatory medications or recommend lifestyle changes to reduce inflammation. GlycA can also be used for risk stratification. This means it helps categorize patients based on their risk of cardiovascular events, allowing for more personalized treatment plans. Changes in GlycA levels over time can indicate how effective treatments aimed at reducing inflammation and cardiovascular risk are. Understanding the role of inflammation can encourage patients to adopt healthier lifestyles, including better diet choices, regular exercise, and stress management. In summary, GlycA is a valuable biomarker for assessing inflammation-related cardiovascular risk, especially in the context of hyperlipidemia and cholesterol management. It provides healthcare professionals with an additional tool to monitor and manage cardiovascular health more effectively. Always consult healthcare professionals for personalized advice and treatment options.